Hello and welcome to Health Live at Seniors Today. We're delighted to have all of you here, and we're delighted to have here with us Dr. Binal Dave. Dr. Dave is a senior physiotherapist and a specialist in geriatric care, women's health and rehabilitation, and also aquatic therapy, and has a fellowship in pelvic floor rehabilitation. She has a certificate on female sex health rehab, a certified manual therapist, a mat prop and reformer Pilates teacher trainer, and a lot more. And we are delighted to have here with us because we are once again in a lockdown situation in Mumbai, a partial lockdown or whatever you call it, and as well as in many parts of the country. So, her tips on the topic that we have today, which is geriatric to GeriActive, physiotherapy lessons for seniors in the lockdown, and of course, in general. Delighted to have you here with us, Dr. Dave.
Thank you so much, Pradyuman, sir.
And how's been the lockdown for you so far? Is it, what is your view of people? How are they bracing in the lockdown?
Yes, sir. So me being a healthcare worker, of course, I'm struggling between staggering work shifts, home, taking care of the seniors at home. So yes, it's a mixed feeling though. We have a lot of COVID cases, plus we have a lot of health concerns around in the city and globally. So let's wait for a good future. That's what I would like to say right now.
Yeah. And physiotherapy is so important these days, and given the fact that normally physiotherapy would always happen in person, how is it doing offline on a Zoom call or whatever? Is that what you're doing right now?
Yes, so we are doing both online and offline sessions. So of course, tele-rehabilitation is the new normal. So most of our clients are taking therapy through video consultations and video therapy sessions. So it is, as I said earlier, the new normal. We are giving them good results through tele-rehabilitation. And as such, the whole health platform has gone through telehealth for all the verticals, I would say.
Unfortunately, the new normal has become the new abnormal or the never normal. And unfortunately, that's what it is. And, this is a question that we've been asking every doctor who comes on our show every Saturday is, how do you see the situation right now? Is this something which is a huge worry, especially because we are now in the second wave and this seems to be more aggressive than the first one?
Yes. So currently, we are focusing a lot on post-COVID rehabilitation because the signs and symptoms and the complications post the COVID is also a worry. And it triggers and sets in slowly into the client's body, like fatigueness, breathlessness, coughing, overall systemic changes. So physical activity, immunity, good diet, lifestyle modification is the key, I would say, in this new normal or new abnormal.
Thank you. And I'm going to invite you to make your presentation, and
Sure.
a request to all the attendees here that in case you have a question, please put it up on the Q&A tab. And the moment Dr. Dave is done with her presentation, we will post your questions to her. Over to you, Dr. Dave, for the presentation.
Sure, sir. Is my presentation visible?
No, not yet. Yes, now it is.
Shall I begin?
Yes, please go ahead.
Okay, just a second. So I currently work with Aquacentric Private Limited. So today's topic is Geriatric to GeriActive. So I'm Dr. Binal Dave, a senior physiotherapist, and as already Pradyuman sir has introduced me, so I would like to proceed. So let's understand few terminologies today before the contents. So geriatrics, it's the care of the aged. What is active aging? It is process of optimizing opportunities for health participation and security in order to improve your quality of life as you age. Now, what's the WHO classification? The young old is 65. Just a second. I'm sorry.
Go ahead.
Give me a moment. So the WHO classification is the young old is 65 to 74 years, the middle old is 75 to 84 years, and the old is 85 plus years and old. So such a good image to have a look right now, a happy image. Let me bust a few myths of old age today. People lose their memory as they age. So what's the difference between the forgetfulness and dementia? So forgetfulness is the normal aging process and dementia is chronic brain disease which loses to memory loss. So here we have the late Anandji Dosa, is the oldest cricket statistician. So age is just a number. So myth number 2 is elderly shouldn't exercise, they might fall. So here we have a lady exercising in a sari, ran a marathon at the age of 78 and is called the Iron Mother. Do you know who is she? Usha Suman. She did her 80 seconds plank. I'm sorry. 80 seconds plank, 16 push-ups at the age of 80. Myth number 3, elderly, they can't pursue their passion. So she started a sporting career at the age of 93. She ran for the first time, completed 100 meters track in 1 minute and 1 second. Who is she? She is Man Kaur, the sanitarian sprinter of India. So today, we are going to understand the systemic changes in geriatrics, associated conditions, and solutions making them geriactive. So let's understand the musculoskeletal system first. What are the changes? Muscle atrophy, joint stiffness, decreased bone density. Women are more prevalent than men. Alteration in posture. Difficulty in transfer activities and impaired gait. Conditions related to musculoskeletal system, most common arthritis. It's in hip, knee, ankle, elbow, osteoporosis, where your bones become porous, fractures, infections like urinary tract infections, pneumonia, frequent falls and neoplasm. Recommendations to improve your bone health. Regular exercises for 20 minutes. So marching, sitting on a chair. If you can march right now sitting on your chair. Aquatic therapy, because it is the safest mode of exercise for women or men in seniors, because Your body weight is offloaded by 1/10%, plus the properties of water will improve your muscle strength, bone health, cardiovascular system, and so on. So this is a core activity. So in water, the core stability and core strength is achieved the best. So we also recommend bone density scan, vitamin D, calcium and uric acid blood profile regularly, fall prevention, maintain mobility, environmental modifications, toilet seats, chairs with armrest, use of walker, elbow crutches. So here are a few self-chair exercises I'm going to show you. So sitting on a chair, is my video visible?
Yes, it is.
Okay. So raising the heels, taking the step out with the TheraBand. Sitting marching. Have ankle weights around and straightening your knee and bending your knee. So these are 5 chair exercises: heel raises, toe raises, sitting marches, taking the leg out and in, straightening the knee and bending the knee. Let's understand the nervous system. So you can see the healthy human brain and the aging human brain. What are the changes? So impaired balance and coordination. So you standing upright, sway, imbalance, and that's how the fall occurs. Cognitive disturbances like dementia, Alzheimer's, diminished reflexes, frequent falls. The change in the posture will lead to wide base gait with reduced arm swing. Conditions related to the nervous system, stroke. So you must always remember the fast word. Face, F is for face, S, A is for arm, S is for speech, T is for time. So face, so all of you can smile along with me and see if there is any discrepancy. A, let us take arms up and see whether one is drifting down or both we can raise up. Speech is, let's try a phrase together. I am the happiest today. And time, as every second counts, take help if any of the 3 are seen differently, then take your help as soon as possible. Parkinson's disease. So this is the typical appearance of Parkinson's. That's the stoop posture, rigidity, flexed elbow, wrist. I'm sorry. So that's forward trunk posture, bent knees, trembling of extremities, shuffling or short steppage gait. So that's the typical picture of Parkinson's disease. Alzheimer's disease. So what will you see? Memory loss, can't solve problems, confusion with time or place, difficulty determining color, and difficulty completing certain tasks. So recommendations to improve your brain health, brain games like chess and Sudoku. Aquatic therapy, healthy habits and diet, exercising of any form, maintaining your diaries, encouraging social and family bonding, stress management, and staying hydrated. Let's understand the cardiovascular system. Valves of the heart become thick and rigid due to cholesterol. Blood vessels thicken and result in elevated blood pressure, declining pumping capacity of heart. This is the difference between the young and the aged heart. So there are atherosclerotic changes in the blood vessels, and you can see the hypertrophy of heart muscles. So let's learn few ways to prevent falls. Proper eyeglasses, eye exercises, few eye exercises, apps that aid in vision, well-lit rooms and regular eye checkups. Improve your lighting, use night lights. Third is rugs and flooring. Install few rugs. Smart technology. Use smart home devices. Use fall detectors. Bathroom, add grab bars. Use non-slip mats. A tall toilet seat. Minimize clutter. Physical activity. And let's see some dietary management. That is, carbohydrates is to be 55 to 65%, protein 15 to 20%, and fat 20 to 25%. Let's understand the genital urinary system. Aging increases the risk of kidney, bladder, and bowel problems, such as incontinence, leakage of stool or urine, inability to hold urine, urinary retention, bladder and other urinary tract infections. So how does pelvic floor rehabilitation help is, like any muscle in the body, pelvic floor muscle is equally important and can be trained with regular targeted exercises. Pelvic floor muscle exercises can help with improving your bladder and bowel. Better recovery from prostate surgery, childbirth, increased social confidence, and improvement in quality of life. Post-COVID complications that linger over time are fatigue, shortness of breath, calf, joint pain, chest pain, memory, muscle pain or headache, fast or pounding heartbeat. So how can rehab help is it improves the lung and heart function, it improves your balance and coordination, reduces risk of fall, improves exercise tolerance, reduces fatigue and stress, prevents joint pain and discomfort, facilitates early return to normalcy. How can we help is through tele-rehabilitation. We do clinical e-assessments, clinical e-therapies. We also do aquatic e-therapies and at the center aquatic therapy, not currently as due to BMC guidelines we are shut, but otherwise we have indoor pools. So I would like to end that I don't believe in age. I believe in energy. Don't let age dictate what you can and cannot do. Thank you.
Thank you very much. I think
Yeah,
on that
this,
note,
yeah,
clearly age is just a number.
correct.
Um, we have a few questions that have come in.
Sure.
I'm going to start with them right away. We will,
Can I stop sharing my screen?
please, yeah.
Yeah. Thank you.
So we have a question that has come in here. What exercise must one do to keep one's muscles of joints or body like shoulders and knees? What are the kind of exercises one must do?
So the focus should be more on mobility of joints and bone health, as I explained earlier. So where the calcium depletion is seen most in seniors is the lumbopelvis, that is the pelvis and the hip region and the lower lumbar region, the wrist hand complex, the foot ankle complex, and your neck region. So you should focus exercises like throughout the week, 3 to 4 times in a week, 20 to 25 minutes of these joint exercises where the joints are loaded.
Right. We have a question from Mr. Ram Malkani, who asks, what are Kegel exercises?
Yes. So Kegel exercises are named by the Kegel person who had founded the pelvic floor exercises. But pelvic floor rehabilitation has evolved a lot. We don't do Kegel exercises alone. We have many other exercises which can be given for pelvic floor strengthening. And as I said, as any other muscle, pelvic floor exercises can also be assessed, trained, and progressed. Like there are dumbbells, there are weights for pelvic floor muscles too available.
We have a question from Mr. Naveen Chandra Shetty, who asks, what type of pelvic muscle exercises would you advise for bladder control?
Yes. So pelvic floor muscles have different fibers like skeletal muscle fibers. I'm sorry, I'm being too medical in this, but to explain it to you, I'm going the medical way. So there are fast muscle twitch fibers and there are involuntary muscle fibers. So each and every muscle fiber has a different role to play. So we include exercises with these three fibers in mind. So we asked you to do the pelvic floor exercises with slow contraction and relaxation, fast contraction and relaxation. And we ask you to recruit your pelvic floor in all functional movements, like in lying down, like in sitting, while walking, while ascending stairs, while descending stairs. So there are a lot of exercises which can be done for bladder control. Thank you.
Right. We have a question from Mr. Devendra Gada, who says, what is sarcopenia? Can you define it in brief?
Pardon, can I have the question again?
What is sarcopenia? Can you define it in brief?
Yes. So sarcopenia is the muscle and the bone loss which comes with aging. So it has been proven through research that aquatic exercises are the best to improve sarcopenia.
Tell me, in a current scenario, and this has been there for the last year.
Correct.
I know a center like yours, you do have aquatic exercises, but what does one do when the swimming pools are shut? Is there something that you can do it in the home?
Yes. So always the exercises are carried over from aquatic environment to the land environment, because we don't live in water, we live on land. So we correct the muscle dysfunctions in water and then we translate those movements on land. And as I mentioned in the earlier question, loading of the joints can be done on land also for the hip, back, wrist hand complex, neck, ankle foot complex. So it's a combination of exercises for aquatic and land.
Right. Thank you. We have a question from Naveen Chandra Shetty, who says, my knees have become weak. So his question is, please suggest some exercise for strengthening the knees.
Sure. So when we talk about knee joint, we have to focus on core muscle strengthening, hip muscle strengthening, muscles around the knee, muscles around the ankle. So it's a group of muscles we need to strengthen in order to take care of your weakened knees. So there are series of exercises. So if you need any further help, I can help you after taking your number or your email ID from Pradyuman sir and can share few exercises for knee strengthening through an email to you.
Yeah, actually, what we'll do is, Dr. Dave, if
Yes.
we carry the takeaways and the edited video.
Yes.
We will carry it on Monday.
Yes.
In that, we will have your office coordinates. So in case somebody wants to get
Sure.
do a teleconsult,
Yeah.
we could do that.
Sure. That would be great.
So Devendra Gada's question was, what is sarcopenia? Can you define it in brief? And his question is, how is it diagnosed?
Yes. How it is diagnosed?
That's right.
Yes. So sarcopenia can be diagnosed through DEXA scan, through X-rays, through MRIs. So it's overall bone health which we need to assess, along with vitamin D profile as well.
Right. Thank you. Mr. Ram Malkani's question is, for improving swallowing, are there any exercises? These exercises are available on the YouTube, he mentions, but could you suggest some exercise for improvement in swallowing?
Yes, sir. So especially for swallowing, there are oromotor exercises, plus a good assessment is required before we prescribe some exercises. So any neurophysiotherapist can assess you and then give you exercises tailor-made for you based on your complaints, keeping swallowing also in mind and the condition in mind.
We have a question from Lata Talreja, who asks, I'm RA positive, age 64. I'm having chest pain due to this since the last few months. I got an ECG and an echo test done. All are normal. Kindly guide with some exercises. And can you let me know whether chest pain can happen due to arthritis?
Certainly. So chest pain, we need to see another blood work also. As you mentioned, your other reports are normal. Due to arthritis, there are changes in the rib joints, thoracic, lumbar cavity, which is where your lungs are placed inside the thoracolumbar cavity. So if those joints are stiff, your breathing can get hampered. So instead of using the primary muscles of respiration, you might use the secondary muscles of respirations, and there's a loading on your cardiopulmonary endurance. That's why you might be having chest pain, but an assessment is required.
Thank you. We have a question from Mr. Shankar Chavan, who says, his question is, what are the exercises to get rid of hernia?
Hernia.
Yeah.
So there are different types of hernias. Does he want to know for any specific hernia?
Well, Mr. Chavan.
So I'll give a generic answer for this. So I can tell you the don'ts, because do's, you can do all your upper limb and lower limb activities, but you can't do heavy abdominal exercises and you can't lift heavy weight when you have hernia. Plus, the correct breathing technique is very important if you have abdominal hernia or umbilical hernia.
Right, he hasn't mentioned
Yes.
this, but We have a question in the meantime. If he replies, we will address it. We have a question from Villa Patwari, who says, are there knee exercises for knee pain? I know you mentioned that in your presentation, but if
Yes.
there is something specific that you can give this to the lady, it would be great.
Yes. So as I taught you, there are chair exercises which you can start with, because I don't know your age and I don't know your other dysfunctions. But those 5 exercises which I taught on the presentation are the easiest to start with, like sitting on the chair, raising your toes, raising your heels, tie a yellow color theraband if you're starting for the first time, and take your leg out and in sitting position. With sitting on the chair, straighten your knee and bend your knee, and you can do sitting marching. Those are 5 simple exercises which I can tell you at the moment.
In fact, for the benefit of everyone here, when the video will be there on our site on Monday. You could also see the presentation once again. So in case you want your memory to be refreshed, that should take care of it. Those of you who are asking questions here, I would request you to mention your gender, which of course can be known through your name, but do mention your age, and if there are any specific health conditions that you have, so that Dr. Dave can answer those questions better. We have a question from Katie Daranchi, who says, Doctor, after a surgery on my navicular bone in the ankle, I have seen if I stand or walk for a long time, my ankle swells and feels stiff. It goes down only after I elevate the foot. Is there any exercise for this problem? She says, I'm 70 years old.
Okay. So yes, there are exercises, but before exercises, footwear modification can be of help to you. So there are foot assessments possible where they take your imprint and then they give you the foot modifications accordingly. Plus, for your ankle strategies, you should start from core muscles, go to the hip muscles, knee muscles, and muscles around the ankle and foot needs to be strengthened. So there are series of exercises we need to do, especially for your ankle. But the best advice currently is footwear modification will help you. Plus, you can try cold compress for 7 minutes twice in a day to reduce your swelling and pain for 5 days.
Right. We have Mr. Shetty. We will have the coordinates, etc., for Dr. Dave on in our article on Monday, and he's saying he's 72 years old and he needs your suggestion for knee exercises. Surely, we would give them. Now we have a question from Ved Prakash.
Yes.
He asks, could you give us some guidance on frozen shoulders, please?
Yes. So for frozen shoulders, there are stages of, since when you are you diabetic or you are non-diabetic. So based on that, we need to do, again, it's a series of exercise. Sorry, I'm repeating my answers, but that's how the kinetic chain takes place. So you have to focus on your core muscle strengthening along with your neck, shoulder, elbow, and wrist exercises. So you start with shoulder mobility, neck mobility exercises. Then we improve the strength of your muscles around your shoulder girdle, the scapula, which is the bone attached to your shoulder. So that's how it is progressed. And from the strength, we go to the endurance so that your pain and discomfort doesn't come back to you again.
Right. Thank you. We have a question from Lata Ramkrishnan, who says, my husband has recovered from partial paralysis. His leg has responded to the medication and physiotherapy, but his left hand is still not showing improvement. What should be the next course of treatment? I guess she's asking for treatment in the form of physiotherapy.
Yes. So I know because I'm working at Aquacentric, I'm not advising you aquatic therapy, but in general, aquatic therapy works best for neurological impairments. So as you have tried normal neurophysiotherapy, once the situation is little better, you can take few sessions of aquatic therapy, and sensory integration is advised to you for your current situation.
Right. Thank you. We have a question from Jay Bhagwan Gupta, and it's a similar thing with Mr. Prakash Kore also. Mr. Gupta says, tell me, please give me some exercises for knee strengthening. And Mr. Prakash Kore says, I'm 70 years old. Doctor has advised me knee replacement surgery. Can knee exercises avoid surgery?
So to answer on this, we need to see the current functional status of yours. What all activities are you able to do in your daily living, plus your x-rays to comment whether surgery is required or it can be delayed or it is not required at all.
Right. Thank you. Lata Talveja asks another question. Is cupping theory advisable for back pain due to change in posture? If advisable, how many days one must get this theory done?
Sure.
Her age is 64.
Okay. So to comment on that, there are types of back pain. It can be mechanical, it can be non-mechanical. So based on the type of back pain, the therapy tool can be decided. So to tell you how many sessions of cupping are advised, we need to see the muscle dysfunction, or is it fascia involvement, or is it joint, or is it disc involvement. Based on that, the number of sessions can be advised.
Right. This is a question from Meena Dave, who says, my mother gets swelling in the knee. Once she is settled, it goes off automatically. We've started with consultation with a doctor who lives in the same building. We started some physiotherapy with machines and oil. What can be the possible cause for such a swelling? Will physiotherapy help in such situations?
So for this to answer, we need to know whether there was a fall, or is it age related, or past history of any ligamentous or soft tissue involvement. Based on that, it can be advised whether physiotherapy can help or medical management is required.
Right. Doctor, there was a question from Shankar Chavan who asked about exercises to get rid of hernia. So he's just responded saying that he's suffering from reducible hernia.
Yes, so my advice will remain same. You can do all your upper limb and lower limb movements, but you will have to avoid your abdominal exercises, and any exercises where you have to hold your breath and do that movement is not advisable, and lifting weights is a strict no-no.
This is a question from an anonymous attendee who says, Doctor, I used to get a massage done pre-COVID, but in the last 1 year, I haven't been getting it done, and I feel that my limbs are crying for a massage. What should I do now? Should I get it done by a physiotherapist? Are there physiotherapists who do offer a massage?
So there are special massage therapists who have been trained with certain qualifications. They are called deep tissue massage therapists. So you can take the massage, but with all COVID safety precautions. So that is what is my advice. So physiotherapists give myofascial release, but they don't give only massage techniques.
Right. We have a question from Shivaji Davle, who says, I'm 75, having varicose problems with slight pain. Is there any exercise to reduce pain and restrict it further?
Yes, there are a series of 21 exercises which are to be done for varicose veins, plus the pain is due to varicose veins or due to hip pathology that we need to assess and then give you the guidelines.
Right. Thank you. Doctor, we have a question which has come in over mail. Doctor, what do we do when we have a lockdown and we still need to keep fit, keep active? Are there any standard exercises that you would recommend that we do?
Sure. So all the exercises which are there on my presentation, starting from your eye exercises, your knee exercises, pranayam, breathing, walking for 20 minutes inside the house. So you can exercise for 20 to 30 minutes inside the house. That is also enough to maintain your health, both physical and mental health.
Thank you. We have a question from Devendra Gada, who says, what exercises are advisable for an osteopenia patient whose age is 58?
Sorry, is it osteopenia?
Osteopenia.
Yes. So I have mentioned it earlier. The calcium depletion happens in the lumbar and the pelvis, wrist, hand, ankle, foot, cervical, that is the neck, and the knee joint. So you will have to divide your exercises throughout the week, like 2 days for your spine, 2 days for your hip and knee, 2 days for your wrist, hand, and ankle, foot. Likewise, 6 days you have to exercise for different joints, plus 15 to 20 minutes of walking along with the joint loading exercises. Morning sunlight between 8 a.m. to 10 a.m. is advisable if you are on medications of calcium and vitamin D.
Right. There's a question from an anonymous attendee who says, Doctor, I have taken 1 dose of the vaccination, and after the vaccination, my arm in which I had got the vaccination was paining for over a week. I'm still not very sure. I have taken the vaccination around 2 weeks back. What should I do?
So for the arm pain, you can use the cold compress 7 to 10 minutes twice or thrice in a day, and simple mobility exercises like shoulder rolls, taking the hands in and out, shrugging of the shoulders. This simple exercises with cold compress should reduce your pain.
Another question from an anonymous attendee is, Doctor, what kind of pillow and mattress do you recommend? There are so many types of ads that one keeps looking at in the papers. But what is the recommended for a good back and so that one doesn't really get shoulder pain?
So the old mattresses made out of cotton are the best ones. The pillow and the mat, both should be made of the cotton wool, the way it was made traditionally earlier. That is best to keep your back and neck health. There should be a 2 to 2.5 with pillow and only one pillow which should rest till your lower neck, and your shoulders should not go over the pillow. That is my advice for you.
That's easier said, right? Most people
Pardon?
yes. That's easier said. Most people
I didn't say that the ads are incorrect or they are correct, but the old traditional ones are what we advise to all our clients.
Great. Thank you, Doctor. We could just go on and on. We've answered some 25 questions here, and I'm sure there are more that are going to be coming in, but it was excellent to have you here.
Thank you so much.
Answered all the questions so painstakingly, and plus an excellent presentation that you made, and you were answering all the questions very well, and I'm sure people enjoyed the session that you made, and they were very happy with the presentation and the exercise that you recommended. Thank you very much for being here, for taking time out, Dr. Binal Dave. And to all the people who are here, we will be back once again with a Health Live at Seniors Today session next week, next Saturday at 5 p.m. Thank you once again, and thank you once again, Dr. Dave.
Thank you so much. My pleasure.